Hey, I'm Hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your Hypermobile host, and today we are talking all about feelings. Specifically, we're going to be looking into what does hypermobility even feel like, because I can't tell you how often I have patients come and see me and be like, I don't know if I'm weird or I don't know if it's just me, but this is what I'm feeling. And then they'll go on to give a really thoughtful explanation of what they're feeling in their bodies. And this experience, although it is and it can be certainly different from how people with normal connective tissue describe feeling in their bodies, there are a lot of consistencies, and I hear the same things from my hypermobile patients repeatedly. So I want to share some of those with you today in case there's anyone out there who's feeling something weird or feeling alone, and this might help you make sense and might help you not feel alone, because that is so important. But to start off the episode, I'm going to be sharing the story of my shoulder, and specifically what I described it as feeling like to the physiotherapist when I was 16, and how that led to some confusion and some miscommunication, certainly in terms of management of that injury for me. And then finally, we are going to be talking a bit about weird feelings and small fiber neuropathy, and how I manage those kind of weird symptoms, and how I recommend that patients manage them as well and communicate them to their appropriately qualified healthcare providers. Now, before we get started, I do want to thank everyone who's taken the time to leave a review. 33 of you so far have done that, and I am so grateful for that. I'm so touched, and to see all the positive feedback, to everyone who's taken the time to email in, it really has meant a lot to me. And thank you to everyone who's been so understanding with the kind of recent hiatus that we've taken from posting the show regularly. We had some audio issues, which luckily have now been resolved, and I hope that you can hear the smooth, buttery, mellow quality of the audio in your ears today. Or if you're watching this visually, we now have video as well, and I'm so happy that we are able to expand the presence of this podcast onto a video format, because I know for accessibility issues that does help as well. Now, today's podcast episode is brought to you by Kitten Energy. So if you do hear some noises in the background, that noise is my kitty cats. That's Cleopatra and Ranger. And they might be running around and making some background noise, but we will try to keep it to a minimum. To get started, my shoulder injury when I was 16. So my shoulders have always been my most hypermobile joints. They are what caused me the most grief. I'm pleased to say they don't cause me any issues at this point any longer. However, when I was 16, I was in agony. I was having pain doing weird things that didn't make sense. So my main complaints to the physio at the time were that I would have pain when running. So that really aggravated my shoulder injuries. I would have pain if I was like skipping rope. Anything that jostled my shoulders hurt. I had pain sitting on a spin bike. I would go and do spinning classes with my mom, and I would get a lot of pain in my shoulders, especially if I didn't change position routinely. I would also have pain sleeping at night. And of course, when the physio was testing my shoulder, I wouldn't have pain really on a lot of those movement tests, except of course raising my arm above 90 degrees was what hurt me. Long story short, the physio was trying to get to the bottom of it, and I remember that she would ask me, like, what does it feel like? What are you feeling? Is it painful? And I insisted, no, it's not pain. It doesn't feel like pain. And she was just very confused. And again, like, some of this is understandable. And hopefully the entire medical and healthcare industry will continue to develop maybe that's not the right word, but will develop a better understanding of different experiences, because we all have different experiences. But she didn't really know what to do with the fact that I wasn't saying I felt pain. So I would go on to say, my shoulder, here's how it feels. And this was the phrase I used, and this is what stuck in my head. And when I mentioned it in a very popular TikTok video about a year ago, I was like, my shoulder, it feels homeless. It feels like it doesn't have a home. That confused her very much, because she was like, does it feel unstable? Does it feel like it's going to dislocate? And I said, no, it just feels homeless. So obviously that didn't lead to a good outcome, but that was the phrase that I used. And that was a phrase which online seemed to help a lot of people kind of recognize what they were feeling in their joints. Because when all that you've known your whole life is hypermobile connective tissue, because this is something that people who have HEDS and HSD are born with. It's not something that you develop. It's a genetic condition. So when you have that, you feel things differently. And if all that you know is you're normal and that's what you felt your whole life, you're not going to really be saying, oh, like it feels unstable, because you don't know what stable feels like. So I think that's why I was using that phrase. It feels homeless. And it's weird for me now. I'm someone, if you're watching the video, you'll see my shoulder muscles. I'm someone who luckily was able to build up quite a bit of shoulder musculature. And my shoulders now, if I had to describe how they feel like they have a little muscly home. They feel secure. But at the time, saying that my shoulder felt homeless and saying that I wasn't in pain, that was the best I could do. And I wish that I'd had a healthcare provider who was able to take that information and interpret it a little bit and work with it, instead of kind of me just like doing my job as the patient. I was explaining what I felt. She asked me what I felt. I said what I felt. But unfortunately, obviously, I was hitting a wall. And that's something that happens with patients all the time. They'll be asked, what are you feeling? And they will say words which result in them just hitting an impasse where they're not saying the right things. And that's messing up the whole process in terms of investigation and appropriate medical management. And this is a huge issue for the hypermobile population. So if we go to talking a bit about what I see in clinic and what I hear from patients in clinic, so now I'm going to share a funny story. And this actually happened, I think it was about 4 months ago when I was in clinic. And I had 3 patients come in on one day and say the same thing. And these patients are not relatives. They're not friends as far as I'm aware. And I don't think they've ever spoken to each other outside of clinic. But it was so uncanny how they all said the exact same thing. So I start off most of my appointments saying, how are you feeling today? Because that's really, really important with hypermobile patients. It's important for everyone, but I want to know how the patient's feeling today, right here, right now, and how they felt since I've seen them, both the good and the bad. So the patients came in, the first patient, and I said, how are you feeling today? And that patient said, I feel like an alien. And I was like, okay. And what does tell me more? I'll say, tell me more. Actually, it's usually the phrase I go with, because I want to give that person space to tell me more about what they're feeling. I think that giving people space is so important in a medical context so that they can literally present to you what their experience is, because that helps me as a clinician. So I said, tell me more. And then that patient went on to explain, I'm feeling this in my neck, or I'm feeling this in my shoulder, I'm feeling this today. And this is why, I feel confused about this. And they gave that explanation. And that was, that appointment was that. The next patient came in and I again said, how are you feeling today? And they said, I feel like an alien. And I said, oh, you know what? That's so weird. You're not the first person to say that today. And then we went on, did the same thing. Tell me more. And they explained to me more about what they were feeling. And then the third patient came in, of course, and it was the same thing. How are you feeling today? I feel like an alien. And I was like, this is very strange. But it really emphasized to me the different lived experience of living in a hypermobile body. And something that I get a lot of positive feedback on are the analogies that I use to describe what hypermobility feels like. So I describe it as being built differently. It's literally a different build. Connective tissue is such an integral part of every system in the human body, your neurological system, your digestive system, your cardiovascular system, your muscles and joints. It is everywhere. And not only is it everywhere, it runs between systems. It's so pervasive. And I think of hypermobile individuals as almost being like a different build in a video game. And again, I'm not saying this in any way that we are not the same in terms of like being human. Of course we are. But there is a different experience that having hypermobile connective tissue gives you. These are people who do literally, in my opinion, both emotionally and physically feel things differently. And it makes sense when you look at some of the science behind it, which we'll talk about in a few minutes. But I think of being a different character build in a video game. And I don't know if this is going to make me seem really nerdy. I don't know if any of you have ever played games like Skyrim or, I don't know, different RPG type games. But I think of being hypermobile as a character build in a video game where unfortunately, you're a bit less sturdy, so you take damage a bit more differently. However, it's still playable in a lot of situations. You just have to find the right way to navigate the game. You have to make sure that you're that really strategic player. You have to make sure that you meet the right people along your journey, and you have to make sure that you're able to kind of level up your character appropriately and identify any issues which are going to come your way. Now, if that's too nerdy, here's another analogy. I think of hypermobile people like they are Goldilocks. So in Goldilocks and the Three Bears, of course, Goldilocks is the young girl who's going to the bear's cottage to have some porridge. And the first bowl of porridge is too hot, the second one is too cold, and the third one is just right. And this is part of my frustration in terms of some of the research, to be entirely honest, that's done on for this hypermobile population, is that I think that a lot of the standard treatment interventions in terms of manual therapy and different things like that, they work, but they work when they're done correctly and done precisely. And it really stresses me in my clinical work because the line between the correct amount of treatment and over treatment is so fine. It's like you're cooking I don't know, a steak or whatever. I'd pick something that's very precise to cook. Broccoli. I'm always making mushy broccoli by accident. But that's me overcooking the broccoli, right? So you have to be so careful in your timing and in your dosage and in your clinical decision making to make sure that not only are you giving that patient the correct treatment intervention, but are you giving them the correct treatment intervention in the correct dose for them on that day. And it changes, and that variability is hard to deal with. It's stressful, and it makes the work really, really challenging. But I think of all my patients like Goldilocks because that helps. It helps me to understand them, and I think sometimes when I share that analogy with them, it helps them to understand themselves. Moving on, I will also think of patients like they are hypermobile people, this whole community. I think of us like we are luxury sports cars. So I don't know much about cars, but I know if you have like a very, very fancy car, you can't just drive it off-road. You have to get it special gasoline. You have to have like special maintenance for it. You have to have it driven by someone who knows how to drive it. And I think that like we are all born into a body, and so many people, especially those with normal connective tissue, they just do what they want. They go out, they drink, they they work that 9 to 5 and they work hard and they play harder, and they're able to do all this stuff. And for most people, if not all people who have hypermobile connective tissue and who specifically have HSD and HEDS, you have to be strategic in how you do things. If you do a little bit too much of anything, you get punished much more harshly. That if you drive that fancy Italian sports car off-road, it's gonna fall apart. It has to be driven on the right racetrack with the right setup and the right gasoline by the right driver in the right weather. And that's kind of what being hypermobile is like, in my opinion. So again, these are not necessarily like delicate people. I think there's this idea that, these are patients where if you breathe too heavily near them, they'll break. And that's not true at all. These are some of like the toughest patients I've ever seen in terms of pain tolerance and in terms of what they deal with. Like, these people are tough, but they need to be treated in the way which is right for them and their unique hypermobile body. And that, again, takes a specific kind of understanding. And this is why I am so grateful for things like my online membership, Hypermobility HQ Discord, where people are able to kind of come together and talk about this stuff, because it helps people realize they're not being high maintenance, they're not being demanding, they are just a bit different, and that's okay. Moving on, the final analogy I want to focus on is that being hypermobile is like walking on a tightrope. Except your tightrope is so much narrower than everyone else's. So the people with normal connective tissue, maybe their tightrope isn't even a rope. Maybe it's like a 30 centimeter wide plank. But the hypermobile people, they're getting like a 1 centimeter wide rope above like a 50-meter canyon filled with crocodiles at the bottom. It is really stressful and really challenging, because typically hypermobile people know that if they do too much of something, and what too much is and what the something is can vary day to day. But if they do too much of something, they are going to get disproportionately punished. And it's not fair, and it's hard. And it means that these patients do need to be a bit more thoughtful in how they care for themselves and what they do. And they need to be better at listening to their bodies, which is hard. And we'll get into that in a second. But it's you pay a higher price for making a mistake. And it's challenging. And I think it's also hard for the medical system as well to understand that these people, you have to be really, really careful with these patients, because if you make the wrong clinical decision, there's going to be potentially bigger consequences for that. And of course, we have problems with these patients being unidentified and not knowing themselves and so on. But the idea of having a tightrope and having to walk it, that's something which at least helps me understand my hypermobile body and how I navigate my day-to-day life. So I hope you found those analogies helpful. I think sometimes that having a lens through which to view a lived experience can be a really, really useful tool, because it just helps you to make sense of things. And hopefully it helps you to feel at home in your hypermobile body, because that feeling of not being at home, of everything feeling just out of place, it's confusing and it's bewildering and it's unbelievably stressful, and of course it's anxiety inducing, because how could anyone not be anxious when things feel so weird and no one is helping you understand why, and you feel alone. So anyways, I hope that helped some of this all make sense to you. If I missed an analogy, let me know. Send me in some feedback. Maybe do a post on a video if I post from this. Comment below if you're watching this video online. But I love analogies because I think that they help people understand what's going on in their body. Now, finally, today, we are also going to talk about weird feelings. And by weird feelings, I'll use an example. So have you ever just felt like you've poured acid on a random part of your forearm that doesn't make sense, and you haven't, and it's fine, there's nothing visible there, but it feels weird? Well, that happened to me a few months ago. So if we go back again, 2 months or something like that, there was a day, for example, where it felt like I'd poured acid on my forearm. And so I looked at it, I stopped, I pulled my sleeve up. It was still kind of cold in the UK. And I pulled my sleeve up and I looked at my forearm and I was like, what did I do? What's going on there? But there's nothing there. Luckily, because I understand small fiber neuropathy, and we'll explain that in a second, I was like, oh, it's probably just my nerves being weird, whatever. And of course, we'll talk a bit about correct clinical management and correct monitoring of that from a patient perspective in a second, because we do want to keep an eye on symptoms in the body. The hypermobile bodies get weird sometimes, and small fiber neuropathy is one of those ways. Now, small fibers are part of your nervous system, and they specifically contribute to the sensation of pain and of temperature, and a couple other things, but the main things are pain and temperature. And it's very common for hypermobile patients to experience small fiber neuropathy. It is a common feature in this patient population. What I find in my clinical work is that, unlike with patients, for example, who are diabetic and they'll experience small fiber neuropathy, but they'll have it typically in kind of a pattern. So it might be in their hands or their feet, or it'll present in a way that it makes sense in terms of what we know about nerves and how small fiber neuropathy affects them. What I find very interesting in hypermobile patients is that they will get this seemingly random small fiber neuropathy. So it'll be like a transient little presentation on a patch of skin, which doesn't make sense from a dermatomal perspective. So it doesn't make sense in terms of a pattern that we can use to understand why the nerves are being affected. It'll just be the most weird little presentation. It'll typically last for a few hours or a day, and it'll go away. And this happens, in my opinion, simply because the small fibers, just like all the rest of the peripheral nervous system, they have a connective tissue component to them. So unlike large fibers, which have a myelin sheath, which is a different structure, these small fibers have a connective tissue. They still have a connective tissue wrapping, just like the rest of the nervous system. And my hypothesis is that in hypermobile people, sometimes that connective tissue sheath can be disturbed or irritated in such a way that the nerve starts to kind of misfire and send weird signals. And that's why we see that strange nervy presentation occasionally, and typically it will resolve. Now, quick note, if you're someone at home who's experiencing that, it's really important that you clock it. So I recommend that patients, they make a note of it. They've had this there, record, make a mental note or write it down, or tell a friend, tell your medical doctor, whatever. And then if it doesn't go away, or if it gets worse, of course, at that point, then investigations need to be done. But very, very commonly, this will resolve within a day, if not a few hours. And to go back to another story from myself, I remember I was about 18 and I was at Fairview Mall in Toronto, actually, with my mom, and we were shopping. And I still get a bit sad about this day because I caused a bit of, I don't want to say a scene, but I was in so much discomfort. So we were walking around the mall and it felt like there was a piece of glass in my jeans. And this resulted eventually in me going to the loo, taking the jeans off, searching carefully, trying to find a loose thread or a piece of something in there that was irritating me. And there was nothing there. And I felt like I was losing my mind. And I wish I'd understand at the time that having hypermobile connective tissue can just make you sometimes feel things a bit differently in your skin, because I would have been like, oh, it's just my nerves being weird for a second. That's okay. But instead, of course, it was really frustrating. I had no idea what was going on. It took away from that day with my mom, which is, which made me a bit sad, because it's always nice to have a fun day out shopping with, your mom or someone you're close to. And it did eventually result in me buying a new pair of trousers, which I wasn't sure if they helped or not at the time. The symptoms did resolve within, I think by that evening I was fine, certainly by the next morning. But that was something which I wish I'd had the ability to understand what was going on at the time, because I genuinely felt like I was losing my mind, because I was, there was nothing there, but I felt this like awful pinpoint like pain on my inner thigh, which made no sense. Anyways, I hope that a little bit of this description of small fiber neuropathy will help some of you if you've experienced that. It is more common in the hands and the feet, simply because, of course, those are the most peripheral bits of tissue that we have, and it's harder for our bodies to adequately supply the outermost parts of us, simply because they're further away from your heart. It takes more effort to maintain those tissues, and that's why sometimes patients will have small fiber neuropathy issues in their hands and feet because they are furthest away. However, it can happen anywhere, and with hypermobile patients that I see, it tends to happen in like a random place and resolve within a day or two, or change certainly, so it'll kind of move around. Again, if this is you, please do speak to your medical doctor about this, just so that it's clocked and reported, and just so that if it's progressing or changing in a way which is suggestive of another condition, because that can happen, we need to make sure it gets identified. But if you're someone where it's like kind of normal for you and you're making sure that you're safe, I hope this helps you understand your body. Now, the final thing that we'll be talking about today is interoception. So interoception is incredibly underappreciated. But first, to understand interoception, we're going to talk about exteroception. So exteroception refers to your 5 senses. So what is it? Sight, smell, touch, hearing, and taste. And that's how we process information about our environment and the world that we're in, basically. It's how I know what's going on in what's around my body right now. Interoception is how you feel what's going on inside your body. And it refers to the phenomenological experience of inner feelings, which just means it's a subjective experience, and it's the collective experience of all that information that you get. Now, what I find for people who are hypermobile is that they struggle with interoception. And to kind of go back to the very beginning of this episode, that story where I was talking about my shoulder feeling homeless and denying that it felt unstable, even though maybe it did at the time, that's an example of someone who is probably struggling with interoception. Feeling things is hard, as I like to say, and it's especially hard when you're hypermobile. And my hypothesis for why that is the case is that connective tissue sheath around the nerve. So we spoke about that briefly before, but all your peripheral nerves have a connective tissue sheath around them. And you can think of it like the wrapping around a wire, like the plastic wrapping. They also have connective tissue inside them and throughout them. But anyways, it makes sense that if that connective tissue is built differently, you might feel things differently. And for me, from a physical perspective, that kind of explains a little bit of this different lived experience. Of course, we can start to discuss how neurodivergence and the high prevalence of that in hypermobile patients starts to contribute to feeling things differently, but that's a topic for another episode. Thank you so much for joining me today. Please do be sure to check out the Discord and keep an eye out for new guides and different types of things that I'm offering. I'm really excited with some of the things that are coming your way this autumn, and I'll share more details on that soon. Take care and see you next time.